Hello and welcome to episode 3 of Undoctored with me, Pooja Avasti. Undoctored is a space where the experts speak your language in all matters health. Our guest today is Dr. Manish Dubey, who is an oral and maxillofacial surgeon. He is currently working as professor in the Department of Dentistry at the T.S. Misra Medical University, Lucknow. Welcome to the week, Dr. Manish Dubey. This is Undoctored. Uh, could you please tell us what healthy teeth look like?
It doesn't mean you have to show your shiny teeth. Uh, Light yellowish teeth are good as far as oral hygiene is fine. The good oral hygiene depends upon how your teeth and surrounding structure, periodontium, are in. They should be in good condition, like no sign of gingivitis, like bleeding in gums during eating or brushing, or no sensitivity to air or any cold substances should be there. No bad breath should be there in mouth. So overall, your teeth and their surrounding structure should be in good condition. That is good oral health.
Right. We do go in for normal checkups, but we tend to neglect our teeth. How often do you say we must go in for dental checkups as well?
We usually recommend visit your dentist at least as regularly at least 6 months. But if you find your teeth are healthy and no signs of inflammation and anything else, you can visit up to 1 year also, but we recommend usually up to 6 months is necessary. If you feel, yeah, or somebody feels like any sensitivity to cold and hot substances, like having a tea, my teeth are sensitive, or having a cold drink, my teeth are sensitive, while eating or something biting, our gums are bleeding, or while speaking, I am feeling that there is a bad breath, we call as halitosis is there. So definitely you should visit your dentist as early as possible.
Is it possible for you to detect other problems when you are examining our teeth?
Yes, while we examine the oral cavity, we usually find there's dental, apart from dental caries, there is various things that can happen in oral cavity also. Like adults nowadays are consuming more tobacco and very deleterious habit they are having. And in elderly people, there are problems in their periodontium. The teeth are loose, or they are feeling pain in chewing or difficulty in swallowing. In children, we can see that early childhood caries, that they are 4 and 5, 4, 5, 6 year old, and they are having the black teeth all around their mouth. So in early childhood, we can see early childhood caries. In growing age, we can see malaligned teeth. Teeth are regular because they are in mixed dentition phase. They are growing and they are in mixed dentition phase. So we can easily detect the malaligned teeth, or you can say the irregular teeth arrangement in mouth. As they grow up, they feel pain and difficulty in chewing from backside. That is time of eruption of third molar. Usually we can say that akal dad in Hindi. Uh, so third molar eruption is usually takes 18 years and above. So in that phase, anyone can feel the eruption pain of that tooth. So these are common finding we usually encounter.
So, all these findings that you are mentioning, these are related to the teeth. But my question is that when you are examining a patient for dental health, is it also possible that you can find out that they are problems related not to dental health, but you can diagnose them while examining the teeth?
Yes, there is a condition like diabetes mellitus. Usually we call as diabetes in layman term. The diabetes is very good indications. Uh, the diabetes are showing the good indications in oral cavity, like diabetic people having loose periodontium, there is a chances of delayed wound healing after extraction of tooth. And it, a particular sign of breath that is known as ketone breath, metallic breath, that we usually detect. So we can easily detect that the people is around 40 to 40 plus years of age might be having diabetes mellitus.
Right, right. As far as bad breath goes, what is the safest way to tackle bad breath? Because people often chew mints, which I'm sure must be having some other after effects, side effects as well. So, what is the best way to tackle bad breath?
The best way is proper brushing only. The first and foremost thing is proper brushing. Brush your teeth properly. Everyone should know how to brush your teeth. Don't apply too much pressure upon the tooth. Don't try to just rub it all in single stroke. Just gently give 2 and 3 minutes to the teeth. Rub in rolling motion. Angulation should be 45 degrees, and it should cover all the surfaces of teeth, like labial surface, lingual surface, and all the occlusal surface, which helps in chewing. So proper brushing can relieve all the problems. Additionally, uh, anyone can use mouthwash, but not for regular use.
Okay.
The mouthwash we recommend is that containing chlorhexidine mouthwash. That chlorhexidine is the disinfectant and antiseptic, which is main ingredient in mouthwash. But we don't recommend for prolonged use, like 4 5 minutes is continuing. So normal mouthwashes like in market, Colgate Plaques and Listerine, they are just mouth fresheners, I can say. They are not having chlorhexidine, the main content, that
Okay.
is disinfectant and
And for how long did you say we should use mouthwash?
in gingivitis or periodontitis condition, we recommend 7 to 10 days only, not for prolonged use, because it has many some side effects also. The staining of teeth, a term dysgeusia, means there's a taste disorder that can happen. So we don't recommend for prolonged use.
Right. And the health of our teeth depends to a big extent on the health of our gums. So, what should we do so that our gums remain healthy?
Avoid sticky and uh, like sticky and acidic food, like cold drinks, chocolates, mayonnaise, lots of things we should avoid. And if we are taking that food, we should know how to brush properly, and twice a day is must for brushing. Before going to bed, everyone has to brush
Right. So that is for the health of our gums.
gums.
And is it true that all of us with age, our teeth will fall off, or there can be people whose teeth will never fall off?
No, not at all. There are many people, many aged people having full set of teeth. Slight wear and tear can happen, but it's not always that they are going to lose their teeth. If oral cavity is healthy, they are using flosses, properly brushing, and taking care of their teeth. It's not always that they are going to lose their teeth.
Okay. Dr. Dubey, do teeth in Indians show some different kinds of illnesses more or less than teeth in other kinds of nationalities?
Yes, in Indian scenario, there is more chances of dental caries because neglecting from childhood has been started. Everyone is thinking that this is deciduous, or you can say milk teeth, it is going to shed off. What is the use to protect earlier? There are chances to come the permanent teeth. Then we take care of them. So it's very necessary to take care of teeth in early childhood.
Right.
Parents should teach how to brush, because 2 to 3 years old or 4 years old child don't know how to brush properly. So it is a duty of parents to teach how to brush properly. Before going to bed, they should brush their teeth. Avoid sticky foods. Avoid like acidic foods. And in elderly people, there are chances of having GERD, a problem that is gastroesophageal reflux disease that contains the acidic reflexes that indicators of uh, erosion in oral cavity. If tooth are erosive and yellowish in shade and having sensitivity, that might be chances of GERD in older age. And in young adults, we are usually watching that they are consuming gutka and tobacco uses, cigarettes. They can cause the staining of teeth, white patches in oral cavity, reduced mouth opening, and definitely oral cancers. So these are various stages in human life that we are usually uh, seeing that the problems are around the people.
So, Dr. Dubey, in your years of practice, what kind of problems do you see more and more now? And in what age groups are these problems more apparent?
The parents comes in early age with um, blackish teeth coloration in their child. That is early childhood caries. We can also say that nursing bottle caries because the child tend to use bottle feeding, and it is not taking care of their teeth and negligence of their parents. So in early ages, we can see that early childhood caries. As the child grows up, we are observing that dental caries, the blackness around the tooth, because bacteria tend to grow up that surface and demineralize that hard tissue structure and exposing the enamel, dentin, and thereafter pulp. When the pulp exposes, that is there is a chances of pulpitis and severe pain. And as the person grown up in adult, I think 14 to 18 years of age, we can see the malalignment of teeth. Because there are chances of eruption of permanent teeth and already having deciduous teeth, the mixed dentition phase. So alignment of teeth may be disturbed. So malalignment of teeth, we usually encounters the young ages. And after that, third molar eruption and dental caries, periodontitis, jaw pain, these are common findings we usually encounters.
And is the age of exhibition of cancer coming down?
No, in India is rapidly increasing. Unfortunately, we can say this is increasing very rapidly in India because every young person is fascinating with gutka selling actors. They are earning in crores, and we are getting just oral cancer in return. So gutka, tobacco, nicotine, any form of drugs we are consuming that is causing deleterious.
So, the age at which they are coming with cancer, that age is decreasing.
We are clearly observing, and some researches shows that 20 to 35 years of age, the people having 20 to 35 years of age is more prone to the oral cancer because of their habits.
And their numbers are also increasing. More and more of them are coming with cancer.
Yes, yes. Oral cancer, number of oral cancer is definitely increasing. When any white patches or any changes uh, is visible in mouth, everyone should immediately report or visit to the dentist.
And what about the gender differential as far as cancers of the mouth go?
Yes, is more prone to the male person. Females are having less oral cancer in comparison to male person because reason is it's obvious, they are consuming more tobacco, that's why they are having chances of oral cancers.
So there are more and more people who want to have their teeth beautified, maybe have some crystals inserted. Is that safe and would you recommend it?
Is it safe procedure? Just we have to put that crystals, called it dental jewelry. We call it as dental jewelry. We put upon the tooth and just bind it with the tooth. It looks good. It depends upon person to person. The female are more interested in this procedure, but uh, we can say just layman can watch, and he must saying that this is looking like the scaries, like a spot. That he cannot appreciate that this is dental jewelry. But in upper status people, they are uh, going for the dental jewelry, and it's acceptable, not harmful anyways.
Okay, okay. So, Dr. Dubey, what are the top 5 myths when it comes to dental care?
After extraction of tooth, there might be chances of losing of their eyesight. First and very common myth. Second is after scaling or cleaning of tooth, my teeth are uh, more mobile than previously they was. And third is only sugar can cause the dental caries. And removing of a third molar, there might be chances of uh, reduced jaw opening or difficulty in chewing. These are some common myths.
Right, right. And what would be your top 3 tips for taking care of our teeth so that they last as long as we live?
First is proper brushing. That is key factor. The proper brushing, you should know how to brush properly, and twice a day, 2 minutes, uh, uh, 2 minutes of time it takes. And flossing, if anyone can perform, that's good for health. Flossing is technique sensitive, so where the brush cannot reach, the floss can reach and clean that surface. So brushing, flossing, and eating habit, like less consuming of sticky and sugary substances, acidic substances. So these are the key factors of having a good oral health.